So folks, there are a few fundamental issues to take into account when you're dealing with patients at large. Now, I'll go through each one of these and kind of explain it a bit so that you understand where I'm coming from. Have a look at the first one, being polite and considerate. Well, what do I mean by that? Well, what I mean by that is exactly what it says on the tin. We need to be polite at all times. Now, that needs to be the case when people are being nice to us, people are being engaging, people are talking to us. But also, it also has to be the case when people aren't engaging with us, people aren't being polite or being obstructive, argumentative, or you find that actually the discussion might be going in the wrong direction. What we suggest is we always maintain politeness, courtesy, find a way to understand our patients well so that we don't have these difficult moments where we're struggling to relate with them, where we're struggling to address their concerns, and overall show consideration. At all times, even when it's difficult and you might be struggling, you want to show consideration, you want to show empathy, being able to relate to your patient. You're there to help your patient at all times. Dignity. What do I mean by that? Well, look, people are of different ages, gender, all right? So let's say a male doctor is seeing a female patient. Let's say an elderly patient is being examined on their own, and the issues that might come up as a result. Let's say you're seeing a patient who is of a different culture or a different religion, for example. What happens there? How are we going to be sensitive to their needs? How are we going to be considerate to their needs? Whether it comes to examining, whether it comes to asking personal questions, whether it comes to, discussing issues in regards to them and conferring with their carers or their family members and so forth. At all times, we want to make sure that it is a dignified situation and we are not compromising that at any time. Privacy, of course, it's no surprise really. At all times, we need to maintain privacy. We need to make sure that our patients' confidentiality is maintained all the time. We don't want to breach confidentiality, unless, of course, we have the caveats of the patient's safety or perhaps someone else's safety, or we need to talk to someone about their care. We need to divulge information for legal reasons. For example, talking to the police or talking to other agencies involved in the care of your patients. At all time, regardless of one's background, one's thinking, whether they're coherent or not, we want to treat our patients fairly, and we want to be respectful to our patients, even if we disagree with certain things they may say or do, and we happen to disagree with them. All right, even when our patients are refusing our advice, our guidance, we need to be able to respect them. All right, we need to be able to treat them fairly and work with them. For example, a patient might decide that they don't want to go ahead with the therapy that you are suggesting. Instead, they'd like to see the herbalist down the road. What do? Do you disengage? Do you say, all right, fine, bye-bye, go and do what you want to do? Or do you say, wait a minute, I understand you want to see someone else. I understand you have a different view. But you know what? I'm going to support you. I'm going to advise you. I'm going to work with you. I'm always going to be here so that you can come back to me if you need to. Are you going to have that approach? A supportive manner rather than a corporate approach, so to say. Now, it kind of touches on the next point which I was going to make, in that at all times, remember, autonomy has to be respected. Patients need to be involved in making treatment decisions. So when you advise your patient about treatment decisions or whatever you want doing, what you want to do is make sure they're on board. So you explain it well, you do it in a language that they understand. If they don't understand the language, you make sure you translate or you get the appropriate interpretation service involved. Make sure they understand the information. Make sure then that they're able to process the information so that they can then kind of almost reflect it back to you, and you are then satisfied that they understand that information. Okay? Now, having satisfied yourself of that, what you then want to do is decide, okay, is my patient going to come along with the treatment decision? Are they happy to come forward? If they have got questions, if they have misgivings, how do we address those? How do we work with them to do that? We can't just impose, okay? We can't just say, well, this is how it's going to be. That's certainly not the way we advocate things to be done in medical practice, the way we work with our students and our doctors in curriculum. So this is something that you need to take into consideration very carefully. We need to be honest all the time, okay? We can't say things for financial interests, for commercial reasons. You know, a lot of us find ourselves working with drug companies, with people who make appliances and so forth, but we always have to maintain an independent approach to the way we deal with our patients. So what we don't do is let that interfere with care processes, with how we're going to decide on priority of, say, medication or surgery and so forth. We don't let things like that get in the way. We need to always be honest and suggest treatments or interventions that is going to be of benefit to our patients, and they need to have that confidence in us at all times. Now, it's very, very important, especially if you are practicing medicine in countries where commerce and finance is part and parcel of healthcare. So, for example, where patients are partly paying for their treatments, or they have to make a contribution, or, you know, in the private sector where people have to pay you. So we have to be very mindful of that, in that there is no conflict of interest. We're not doing something that because there is financial gain. We're not doing something because actually it helps our statistics. No, we are doing something. We are going to intervene, we are going to treat, we are going to operate or whatever, because it's in the right interest of the patient. It's in the best interest of our patients. Okay? If it so happens that we're involved with research, we are involved with a pharmaceutical company or some kind of study or something, or perhaps we have links with certain commercial interests or companies or so forth, then we need to make that clear. We need to declare that to our patients, to our population, to our service users, and make sure we are not conflicted. Where we are conflicted, you might want to back off and not be involved in that process of care, in that patient pathway. Don't forget, most of us have got policies in place. My patients are giving me flowers, and they're giving me cards, and they're giving me chocolates, and gifts which we feel as an organization is acceptable. Okay, now that might mean a small amount of gift, say a few pounds or a few dollars. That's acceptable. Okay, that's okay. There's a universal acceptance for gifts like that. But what would you do, for example, if a medical rep comes to you and says, well, doc, we've got a holiday for you to Singapore, and it just so happens we'd like you to consider prescribing these, or giving this out to your patients or something. How would you behave in that situation? Would that affect your prescribing? Do you take up that holiday? What if a patient comes and gives you a diamond watch or something as a gift? What do? Do you accept it? What is your policy? What is your governance around this? What's ethical about this? Are we going to look after patients who give good gifts as opposed to patients who don't? Are we going to differentiate? Is that going to affect access? So these are things to think about.
Yeah.